DuraPrep today. DuraPrep is a prep solution. It is composed of alcohol and iodine perfacolax. It covers an area of, about this large with a 26 mil applicator. That is the larger applicator. We also have a smaller one, but this is the one that you would see used in OB that you're probably familiar with. The most important thing about using this is to make sure that it's dry. Because of the containing of alcohol, it is a fire hazard. And this is a photograph of 4 different skin types and after application, as well as signs to look for when it's dry. You notice that it goes from a shiny to a dull finish, and that's what you want to look for. The dry time is, however, 3 minutes, and I understand that you do time that here, which is fantastic. When we prep for C-section, we follow this diagram here, starting at cleaning the umbilicus, and then working our way around the incision site, ending up our last step being at the pubis area. Look familiar?
Yes.
Okay,
yep.
Great. So I always like to start out with having people read the instructions on the package insert or the instructions for use. So if you want to go to directions kind of in the middle of your page there, and we'll just follow through, and you're free to take these also if you'd like. So at the end, we want to discard any solution that we don't use. So while we do have this coverage area, we might not be covering all of this area. So don't feel like you have to use the entire solution. All we want to do is paint on so we get a nice, even application. Okay. The iodine perfacolax in this product is what makes it stay. So it kind of creates a film. What's really nice about that, and you've probably noticed, it doesn't wash away easily. It stays there even if you have blood and a lot of irrigation. So it stays there and it fights off the microbes for at least 48 hours. Okay. So getting ready for patient solution, you want to use it in a well-ventilated area because of the alcohol odors, and make sure the area is clean and dry. I understand you do a HIPAA pre-prep.
Yes.
That's fantastic. You just want to make sure to wash off that residue before you apply the DuraPrep.
Oh, that's something we haven't been doing.
Okay.
We've just been, washing the tummy, the incision area with the HIPAA cleanse, and then, because it's like a
And then
white.
Oh, it's a white.
Well,
Okay.
it's probably not HIPAA cleanse. It's
Is it just like a sage white or?
Chlora. Gosh, I have the package downstairs too. It's just like a pre-moistened white.
White. Okay.
Yep, and then
Is there residue after?
it looks clear to me.
Okay.
But I don't
So
know.
if it's clean and there's no residue, it's not an issue.
Okay.
Not an issue. I was thinking more like the HIPAA cleanse.
Yeah,
water and
no,
soap.
this is just like this pre-moistened
Okay. If you do shave hair, I understand you do clip, not shave, but that you clip prior to going into the OR.
Okay.
That's fine, that's good. The only thing you want to remember, because this product does contain alcohol, if it's emergency or you're not clipping for some reason, there is hair. If you do get the product on hair, the dry time is much longer. It's up to an hour. So you want to be sure to either dry that area with a sterile towel or wait that 1 hour, which you probably aren't going to do.
Right. Okay.
So clipping is probably what you'll see most often. You want to make sure that when you activate the applicator that you hold it parallel to the ground, to the floor, so that you get an even distribution of product on the sponge. That will prevent any leaking and pooling of product. When you apply it, again, you want to paint it, do not scrub it, apply uniformly. You don't have to go back and forth at all. Sometimes on some occasions, if someone's really skinny or you're a sloppy prepper, you might want to put towels on the sides of the patient to avoid pooling of the product, okay? That's pretty much it. So let's go ahead and prep. To open, just open it up like this. And if you do not use gloves at all, you want to be sure when you do go to prep the patient that you're holding it here as opposed to here.
I think that was a question of the staff. There's some OR nurses that prep with sterile gloves and some do not. So do you need to use sterile gloves?
You don't need to, and AORN says your hand needs to be 12 inches away. So we don't advise either way, but a lot of people do use sterile gloves just in case they need to touch or
Okay.
And, you know, and it keeps the sterile. But as long as you're 12 inches away, you should be fine.
Okay.
And you practice good hand washing. But non-sterile gloves are fine too.
Okay.
So to start the process like you do, we'll go ahead and have you do that. Press, yep, very good. And then you're going to watch it till it goes to the line there. And then you know that your applicator is fully moistened. If you're going to prep the umbilicus, now turn it over, you're at the line. So you have a nice even area there. Take your sterile Q-tips, if you're going to prep the belly button, and just dab that to get some solution. And then if you do the belly button, you just want to do that first. That will be step one. Perfect. And then you're going to start at your incision site, and this instance is your incision site here, just using a back and forth motion.
So I'm going to go down first.
First
Start
you're going
at
to do
the
the
belly
incision site, and
Okay.
then you're going to go around, you're going to do this area last.
Okay.
So
So start here.
correct. Are we in the shiny? Yeah.
And then right up to underneath the breasts, right?
Right, perfect.
Okay.
Then you're going to do the upper thighs, so you could start like here and do that.
So a lot of the people do the sides next.
Yes, and our diagram is not the real thing. If
Right.
it were 3D, you would
Then I would do the sides.
So this
Okay.
is this here is all contained within these swipes.
Okay, so if I can do the sides.
Yeah, but someone that's really large, and this is not like the holy, you have to do it this
Okay.
way, especially with a pregnant belly. You may end up doing one side to the bed, but not touching the bed, walking to the other side, and then
doing
the
that.
other side.
Okay,
Yeah.
so my sides
Because you
are
don't want
covered.
to reach over, right? If you got really big belly and risk contaminating.
Sure. Oh, that's right. So you're 12 inches away. Okay.
Right.
And then I would come down here
Here I can come down.
and then do the thighs.
Right.
And so
Just kind of like this. Yeah.
okay. Should I start from the outside and go in or in?
It's going to depend on the anatomy, but yeah,
Okay.
basically you want to end up in the dirty area. Consider the dirty area
Last. Okay. So really it's just painting it nice and even.
Exactly.
And then
And with it, you can feel like when you press, you can feel like the application, right? And then you can see it. So you know that you're getting product.
where
Because
it's
it's nice, your sponge is nice and covered, and you're making contact, so you know that you're getting coverage.
Okay.
Perfect. And now we can time it, or as you start our timing, we can also watch for on this paper, watch for the dull finish, and then we know that we're dry.
Okay.
We know we're at age 55 here now.
Very good. And then the unused product, this just can get thrown away, right?
Thrown away, yeah.
Okay.
It looks like you used about all of it. If you had extra, it's fine to discard it. You don't need to use all of it.
Don't need to use it up. Okay. Very good.
Any questions? You want to take this
Yes,
with you?
that would be great.
Okay, perfect.
Thank you.